And it works pretty well as long as you catch it right away. But if the damage has already been done in the liver, then it's too
right.
late. And the other condition that is really bad is chronic alcohol consumption.
Mm,
So chronic alcohol consumption really ramps up that enzyme that makes the quinonamine. It ramps up the CYP2E1. And
mm,
there's so many parallels between fetal alcohol
I
spectrum
see.
disorder and autism spectrum disorder, right? It's
I see.
and part of that is they're tied in even in adults if
So,
you
so
consume a lot of alcohol.
yeah. So it sounds like it would be, I mean, I've personally witnessed this multiple times in my life. You're out partying one night, people are drinking, they're anticipating the hangover the next morning. So they pop some Tylenol the night before. That sounds like it's a really bad idea.
It's a really bad idea. People have died from that, but again, it's not common.
Mhm.
So and there's a mother online that we've talked to a lot and that helps us broadcast our stuff. And her 20-year-old kid in college, that's what killed her. I mean,
Yeah.
just
Yeah.
from one day to the next, because that was her habit.
Yeah.
She would drink, take
Right.
Tylenol, and then one
But also,
day,
but even if you're not taking like a mega dose or anything, just over time, year after year, decade after decade, that's just going
right.
to you're going to accumulate more oxidative damage if you're in the habit of combining those types of things.
Absolutely, and that puts you much more at risk. So that, and what the drug manufacturers say, well, those two people that die every every week, those they had pre-existing conditions, which is probably true. There was something going on there, maybe chronic alcohol consumption, and we're not talking about intentional overdoses. That's separate. The ratio of getting liver injury intentionally versus just taking average doses for prolonged periods of time and getting hurt that way, it's probably about 50-50 just in terms of the number of people that get hurt.
Yeah, and so just to say it out loud and just to be direct about it, your opinion, based on your expertise, is that we should not be giving acetaminophen to pregnant women. We should not be giving it around the time of birth. We shouldn't be giving it for the first few years of life.
Yeah, so as a scientist, we can say it's dangerous. This is what it does. It causes autism spectrum disorder, probably ADHD, maybe developmental delays, although maybe not. Anyway, the bottom line is that, and that's affecting, if you count ADHD in there, then you're affected. In ADHD, we normally don't deal a lot with that because it's a little bit, even diagnosing that is kind of squishy. But the bottom line is it's affecting a lot of children. So as a policymaker, when I talk with policymakers, this is what you should do. Absolutely no question about it. You should issue, the FDA should issue this thing called a contraindication. You shouldn't be using this drug during a certain time frame. But when it comes to personal medical advice, we can't give that. So it's a weird
Mm-hmm,
situation we
mm-hmm,
have where we can't tell the average mom what to do. We can only tell her, this is what we're recommending for the regulatory agencies to do, and this is what we know the drug does based on, and I say no, which means concluded without a reasonable doubt. This is what we know the drug does. So then you have to make up your own mind. Because we're not medical professionals,
mm-hmm, mm-hmm,
we can't tell the individual what to do, but
mm-hmm,
we have published our recommendations
mm-hmm, mm-hmm,
for
mm-hmm.
the
Well, let's say so. Let's just say hypothetically, you've got a 1 or 2 year old at home, and like any other 1 or 2 year old, they're going to have a fever from time to time. They're going to be in pain. They're going to bump their head. Stuff's going to happen where a normal person might want to reach for some Tylenol or something to bring some relief to their child. Perfectly natural.